Hello and welcome, everyone. I'm Yvonne Chua from the Philippines. Let me introduce our distinguished panel for this session. Deja Herbilok of the Science Media Center in New Zealand, Varadarajan Anantakrishna of Data Leads in India, Nobuyuki Okumura of FactCheck Initiative Japan, Jongyun Hong of the Seoul National University FactCheck Center in Seoul in South Korea, and David Harlambang of Katadata in Indonesia. Thank you, Deja, Raj, Nobu, Jongyun, and David for joining this discussion on vaccine misinformation. I'll jump right into my first question, and it's addressed to all of you. What do you consider as one of the most harmful pieces of vaccine misinformation that has circulated in your country? And how has it affected vaccination efforts there? Let's start with David.
Okay, thank you very much, Yvonne. Firstly, I'd like to share a piece of infographic that you guys can see on screen. So basically, this infographic, we are using it to combat such misinformation. So the most dangerous one is vaccination will cause lymphocytosis and eventually lead to fatality. This can be misinterpreted as vaccination could cause deaths, and this prevented a lot of people to get vaccinated since they are all frightened. Vaccination only caused a small increase of lymphocytes increase during the immune system formation. In fact, lymphocytes increase due to the vaccination is much less compared to the actual COVID-19 infection. Thank you, Yvonne.
Thank you, David. Nobu, would you like to go next?
Hello from Tokyo. I'm honored to report the situation in Japan. We have the same kinds of misinformation such as infertility, genetic modifications, fetal damage to expecting mother, also conspiracy theory like vaccine inserting microchips in your body. But I would rather like to discuss how journalism in Japan dealt with these kinds of misinformation. Mainstream news media have not been active countering misinformation since before COVID. And such environment allowed some middle-sized media outlets overemphasizing side effects on the internet. News media lacks a balance, seems to have failed to explain rational choices through public health perspective, as well as necessary policy recommendations to encourage the movement. This is rather a journalistic issue, but closely related to vaccine misinformation. Thank you.
Thank you for those insights, Nobu. What is it like in South Korea, Jongyun?
I'd like to say that vaccination in South Korea has been going smoothly. If the current trend continues, the proportion of people fully vaccinated against COVID-19 is expected to exceed 70% at the end of October. If we had to pick out the worst piece of misinformation that affected the vaccination, it would be misinformation about the side effects of vaccine. For example, the vaccine could cause cancer or dementia or infertility. However, it can be seen that the impact was not large enough to affect vaccination. The percentage of people who refuse to be vaccinated is very, very low. The problem was not the refusal to vaccinate, but rather that the supply of vaccines was not keeping up with the demand for vaccines. Thank you.
Thank you, Jongyun. Raj, is it any different in India?
Thank you, Yvonne. In India, there is a there's a flawed theory that vaccines are ineffective because you do get infected with the virus anyway. So why do you want to inject some foreign material in you? That cannot prevent you from either the infection or passing on the infection to others, even post vaccination. There's a substantial online population peddling this misinformation. What is worrisome is the traction that they get, number in terms of number of shares and number of the comments in the comment section which support the anti-vax theory. So in India, going by the numbers the country has been racking up recently, it doesn't look like it's not evident that they're contributing to any vaccine hesitancy. However, the danger is even a small percent of the population chooses to stay unvaccinated. That could spell a lot of problem. And of course, the conspiracy theories, which are everywhere, is also there in the regional languages in India, on social media, which says there will be microchip installed in you, and the government wants to do surveillance, etc. So those are the narratives. Thank you.
Thank you. That's rather worrisome, huh, Raj? How's the situation in New Zealand, Deisha?
In New Zealand, we've pursued an elimination strategy for COVID successfully enough that we have spent nearly 18 months with essentially no virus circulating in the community. So that's meant that we've seen very few cases and very few deaths, fortunately. But when it comes to misinformation, what we're mainly seeing is there has been importing of misinformation coming from overseas. So it still enters the country, despite the borders being closed via YouTube, Facebook, other social media. And what we're seeing, it's a very typical flavor. So the same kinds of things we hear about, questions about vaccine safety, questions about impacts on fertility. It's too experimental, it's too risky, and even assertions that the vaccines don't work. So what this has really led to is, I would say, a widespread sense. It's contributed to a lack of urgency. What we've seen with the most recent Delta outbreak that has happened in our largest city, Auckland, since last month, is a massive shift and turnaround in this approach. So we're now seeing a very, very speedy ramp up of the vaccination efforts, and that really time will tell whether that will be something significant enough impact to prevent us from reaching this goal.
Yeah, that seems to be a problem, not just in New Zealand, but in many parts of the world, huh? Deisha, your center, the Science Media Center, serves as a sort of bridge between scientists and journalists to promote accurate evidence based reporting on science and technology. In your experience, what has been like the biggest challenge that scientists in general and scientists in New Zealand face when they work with journalists in communicating vaccine related information?
Well, we're quite fortunate here that in New Zealand there has been, since the outset of the pandemic, really a very strong demand from news media. We see them turning to scientists to seek information and to help understand all the complexity from this disease. It's really a very positive thing that there has been this strong instinct from journalists to want to talk to scientists about these concerns and to help them navigate this complexity. But a challenge for scientists along with this has been, the need to adapt to the demands of news media. So for the most part, we see that journalists very naturally will want to ask a wide range of questions. Scientists tend to be quite specialized, on the other hand. So they may be very comfortable speaking about their own field in immunology or epidemiology. But of course, a journalist will be asking about implications for the wider population. What's your advice for parents who are concerned about their school-aged children? What should we do about wearing masks? So it's been a very, very small number of scientists who have been, really recognized for their excellent skills in being able to communicate very broadly, very accessibly.
Thank you for sharing your insights, Deisha. Seems like our scientists still need to figure out how to get their message just across more effectively to journalists and the public. Raj, Health Analytics Asia, this is so interesting, is Data Lead's flagship program. It fosters, just like the Science Media Center in New Zealand, it fosters collaboration between journalists and, in this case, health professionals, as well as data analysts and technologies to strengthen health reporting, not only in India, but across Asia. From what you've seen, how do journalists in the region fare when they report on COVID 19 vaccines? Tell us also about the initiatives of your organization to raise the capacity of the media in our region, the entire region, to help them report responsibly on COVID 19 vaccines.
Thank you, Mohan. Thank you for the question. Initially, there was about the reporting. Initially, there was a tide of misinformation about the vaccines. In particular, there was just one brief period just before the approval of vaccines. There was a virtual race on which vaccine was in which phase and whether they will meet with approval or not. There was a lot of inaccurate reporting then. because that was also because there was a lot of lack of data in the public space. On the efforts of Health Analytics Asia, we've been at the forefront of COVID reporting and data visualization. We have two verticals that are doing exceedingly well. First Check is a health misinformation fact checking initiative that is spread over 19 countries and has 44 members. We track, spot, and debunk all health related misinformation, especially related to the pandemic and the vaccines. We have built a team of doctors, data researchers, and fact checkers who help us in this initiative. Our other vertical, the newest baby, Crux, is making health data accessible to all with infographics, dashboards, as well as visualization. So that's it. Thank you so much.
Thank you. Let's hope that Health Analytics Asia will be able to reach more journalists in the region as well as in the Pacific. Let me turn to Zhongyun. The Seoul National University Fact Check Center is, I learned, the first and only fact checking platform in South Korea. Would love to hear about the impact that the fact checks of your center and its 31 media partners, the impact that is they have had, the fact checks have had in boosting people's confidence in vaccines and in South Korea's vaccination drive. Jong-yun?
Thank you, Yvonne. South Korea is evaluated as an exemplary case of the successful prevention and control of COVID-19 without implementing massive lockdown. I think SNU FactCheck and its 31 member media partners have influenced South Korea's vaccination drive in two major ways. First of all, SNU FactCheck serves as the most used fact-checking platform. Fact-checking content of SNU FactCheck is also released on the news section of the Naver portal service. Since Naver is the most widely used portal service in Korea, to being released on the Naver news section means that it can reach the most people. Second, SNU FactCheck serves as the most reliable fact-checking platform. For example, the Seoul Metropolitan Government has provided SNU FactCheck content on its official website of COVID-19 information. The SNU FactCheck is making two special efforts to maintain impartiality and nonpartisanship. For that reason, the content of SNU FactCheck is rated as the most reliable, and I think it has had a positive impact on South Korea's vaccination drive. Thank you.
That's interesting, Jong Yoon, and it's good to hear that fact checking in South Korea, as well as those done by Analytics Asia, has made a difference in people's lives and in the vaccination efforts of various countries. Nobu, I understand that fact checking hasn't really made much headway in Japan as it has in South Korea or in India. That being the case, what do you think are some of the lessons for the news media in Japan when covering vaccine misinformation?
Oh, yes. What I would like to share with you here is that we frequently heard and witnessed difficulties to persuade those who are hesitating to be vaccinated, and also who would not believe the effects of vaccines. Such difficulty is serious when it comes to communicate with family members and close friends. You cannot successfully persuade them by simply showing the result of fact checks. Sometimes they do not work at all. Those fact checks should look, and it is indeed, solid and convincing with scientific evidences. However, such style often sounds cold-hearted and lacks empathetic touch, never provide a chance for those people to change their minds. If so, news media needs to do something more than providing fact-checking when covering vaccine misinformation. It looks not enough to try to extinguish small fires one by one. The question is how media contribute effective conversation to promote better understanding between hesitants and supporters of vaccination.
That's really a tall order that we're looking at, Nobu, huh? David, Katadata is known for its knack for, simplifying complex, highly technical stories and turning them into attractive infographics, just like Health Analytics Asia. I've seen some of your infographics on COVID-19 and vaccines in, Indonesia's vaccination campaign. My question for you is, how can the media ensure that they don't oversimplify messages related to the vaccines and run the risk of misinterpretation when they convert these messages into highly appealing visuals. How does Katadata do it?
Okay, thank you, Yvonne. Now I'm gonna get a bit technical in terms of the how we avoid uh, too simplifying information in an infographic. So basically, number one, avoid the flood of information and messages in an infographic. So I'm going to share my screen again using the same infographic that I used for the first question. Now you can see that we try to avoid to only have the maximum three layers of information in one infographic. So by limiting the amount of information, you can create a good and logical story, and this will be responsible in preventing misinterpretation and confusions. Lastly, avoid implementing assumptions. So no assumptions in the infographics, just focus on facts and data and credible sources. Thank you, Yvonne.
Okay. Thank you for those useful reminders, David. The three-layer rule, the importance of a logical flow, and of course, sticking to facts. I'd like to bring this interesting discussion to a close by asking each of you to advise the media what else you think they can or should do to help stop the spread of vaccine misinformation. Let's get a one liner from each of you. That's now a challenge. Jong Yun, let's hear from you first.
Thank you. I think the news media should further strengthen its fact-checking capabilities. On the other hand, active interaction with media users is also necessary. Through active interaction, media users should be able to check vaccine misinformation and make correct judgment. Thank you.
Nobu, what's your advice?
Yes, become social media savvy. Have a good understanding on proliferation of messages, including misinformation, and quick and fair assessment of the social impacts. Beware of your news reports on spreading of misinformation that could even make the matter worse. Super basic, but important fundamental. Thank you.
David, what's your sweet and short advice?
Okay, so it is important for media to provide information based on facts and data. Additionally, credible statements from respectable sources with easily understood and relatable language to its target audience must also be implemented. Thank you, Yvonne.
Deisha, give us your advice.
I just want to push back a little on what you said earlier, Yvonne. The scientists that have been doing an incredible job, actually, at putting themselves forward and working really hard to adapt to challenging circumstance. So I've seen some amazing efforts and often at great personal cost. My advice to media is really to build relationships with those scientists. When these interactions are happening on a foundation of trust, then we see that there's incredible potential to positively influence these concerns.
Thank you, Deisha. And finally, Raj.
My advice to the media in our region is don't be in a rush to break news first. Verify all information before you share and improve your data and content verification skills. That's pretty much it. Thank you.
Thank you, Jong Yun, Nobu, David, Deisha, and Raj for those thought provoking pieces of advice. Thank you for joining this session. It's now our participants' turn to ask you their questions.